Welcome to the Zebra Crossing. Today we have the pleasure of speaking with Dr. Rajesh Gacche, Fellow of the Royal Society of Medicine, London, and Senior Professor and Head of Department of Biotechnology at Savitribai Phule Pune University. Dr. Gacche's extensive research in cancer biology treatment has made significant contributions to the field. Today we'll be discussing his insights on cancer, its treatment, and the future of oncology. Welcome to the Zebra Crossing. First of all, could you tell us a little bit about yourself, your background, and your education?
Yeah. Thank you so much, Janhvi, and welcome to the Savitribai Phule Pune University. Actually, at the outset, let me appreciate you because in this age, many students endeavor for doing different things, but I really appreciate your passion of introducing people, those who are doing their area of interest. My family, background is little bit of, I born in a family which was socially and economically challenged,
Okay.
right? And my parents were illiterate, but they had, I think, courage of admitting me into a school, and that's made something difference. I completed my primary education in the school, in my village itself. And then for middle school, I used to walk around 7 to 8 kilometers every day. And we finished that middle school. Then I joined Nanded city for higher education. There I finished my graduation and post-graduation. And after that, actually, to be very frank and honest, I was interested to become an administrative officer, Indian IAS officer, for a simple reason, because I have experienced the social, torture from the people of so-called, at that time there was a lot of things which I experienced during my childhood. So that was the reason I was thinking that I should streamline all these social ills, and the reason I went, I appeared for the UPSC examinations. I cleared prelims, cleared mains, but unfortunately could not succeed in final call, and I was not. Meantime, I gave an entrance exam of CSIR NET, which is very prestigious examination in India at that time also. And I cleared this NET examination and then joined the research, because at that time I used to get some around 25,000 rupees fellowship, and that was sufficient for me to fulfill my needs during education, because my family background was so much poor, so much painful, and we don't have enough money even to run this all, my parents used to work in the cotton factory, and my mother was housewife.
Okay.
So that's how I completed my education, higher education. Then through that fellowship, I joined the PhD program. And then I finished PhD in 2002, right, with the help of that fellowship. And since then, I think I got a lot of interest in doing science. I thought that, and I genuinely feel that the science is something, which people have nothing to do with whether it is applicable, non-applicable. They just wanted to know what is behind the reasoning. They just want to know why this is happening, isn't it? And that compelled me to in the mainstream of doing research. And since then, I started doing work in cancer biology. So up till now, I think I may have published around more than 150 research articles, including in all the journals of reputed internationally. I finished some 20 research projects from all funding agencies of India. I have 9 patents to my credit.
Wow.
And meantime, this entire story of my work was appreciated by Royal Society of Medicine, UK, and they have given me an honorary fellow of Royal Society of Medicine. So that's how my entire journey is about.
Wow, amazing. Yeah. As we start, can you tell us what is cancer and how does it develop in the body?
See, starting from the conservation of when the sperm unites with the egg, since that stage, every cell divides in a very particular pattern, isn't it? There is no deviation in dividing the cells, isn't it? Because once the that zygote multiplies and remultiplies, we develop into an adult animal, right? What happens in cancer is that the cells are insulted with so many factors, isn't it? The major reason, if you ask me that what is the main cause of the cancer, I will say that mutations in the DNA is the
Okay.
main cause of the cancer. Now, we will have several questions in mind that as to why these mutations happens in DNA, isn't it? So there are several reasons. So it's not a cause of one factor, isn't it? The initiation of cancer is not a one cause factor. For example, if you have predisposition of the environmental exposures, for example, tobacco smoke or the radiations, the carcinogenic chemicals, or the some of the such inherited disorders, something like that. Some people carry the viral genomes into their cells, and that those viruses are called as oncogenic viruses.
Okay.
They also cause the cancers. For example, human papilloma virus, HPV, which causes cervical cancer, is because of the virus, isn't it? So in general, you can just understand that the initiation and causation of cancer is a phenomena of several factors, and we cannot attribute that that one factor is responsible for that initiation of cancer. But overall, the bottom line is the mutations in DNA is the main factor.
Okay.
For example, I will tell you that in our cell there is one protein called as P53. This protein is essentially called as the guardian of the genome, isn't it? That means it decides at what time the cell should divide and at what time it should stop.
Okay.
Even in that protein also, the mutations occur, and thereby the cell loses its normal divisional capacity, and it start dividing in uncontrolled manner, right?
Okay.
So this uncontrolled manner growth is a consequence of these several causes, isn't it? And then these cells, divide, redivide, generation of a tumor. Then these cells leave the parent tumor body and migrate to some other place, what we call as metastasis. And at metastatic stage, the survival of cancer becomes difficult.
Okay.
Yeah.
The latest breakthrough in cancer treatment is immunotherapy. How is it different from the traditional chemotherapy, and how is it changing cancer treatment?
Yeah. It's a good question. See, what we have conventional therapies about cancers are related with radiation therapy, chemotherapy, etc. These therapies are, not selecting the cancer cells. They are indiscriminately killing the other cells also,
Okay.
right? But in immunotherapy, what we are doing that we are giving we are selecting such a cells, immunocells, and giving them better training so that they will selectively identify the cancer cells and kill them.
Okay.
Isn't it? So therefore, immunotherapy is called as a curative therapy for a simple reason that it is not killing indiscriminately the other cells. These immunocompetent cells, which are tailored that way in the laboratories, right? So these cells will identify the cancer cells precisely and will only kill the cancer cells, and
Okay.
they will make rescue of other cells. Unlike that in chemotherapy, majority of the chemicals, drugs, what we take, they are not selectively killing the cancer cells. They are also killing the normal cells as well, isn't
Okay.
it? So there are two categories, I will say that. One is immunotherapy is being implemented at two levels. One is the CAR T cell therapy. This particular CAR T cell therapy is nothing but CAR means chimera antigen receptors, isn't
Okay.
it? T cells. So what we do here, we remove the T cells of patients, and to these T cells, we engineer the T cells by embedding the cancer cell specific receptors. Okay. So when you inject the cells in the body, they will just go in the body and find through these receptors will only attach with the cancer cells and kill them.
Oh wow.
Okay. So this is one of the interesting, this is one wing of immunotherapy. The other wing is that there are some proteins in the body which essentially hijack or essentially suppress the immunity, isn't it? So people have developed drugs against those proteins which are inhibiting these proteins. People have developed drugs which are inhibiting these proteins. For example, PD-1 protein. This PD-1 protein is responsible for suppressing the immunity.
Okay.
So people have developed drugs now. If you give the drugs like PDL inhibitors, what they will do? They will inhibit this protein. As a result of that, your natural immunity will activate.
Okay.
And then your natural immunity will take care of killing the cancer cells. So at these two wings, immunotherapy is working. There are a lot of research is going on in this field, but much needs to be achieved. Again, I will say that.
Okay.
It has just launched. There are several aspects of this immunotherapy. Sometimes we can discuss this in detail. Okay.
I have also read about something called personalized medicine, and I hear it's getting a lot of popular nowadays. How is this approach evolving, and what are the challenges that it's going to face?
Okay, interesting question. See, every individual on this planet has its unique signature. Nobody is similar to other person, right?
Yes.
So in the same way that every person's genetic profile is different, every person's metabolic profile is different, every person's physiological state is different, every person's immunostatus is different, isn't it? That means in short, we cannot prescribe the global medicines to all people, isn't it? Personalized medicine is something like analyzing these all aspects of patients and then analyzing that data. For example, if I analyze your in personalized medicines, what people usually do, you take out the mass of the tumor or the cancer tissue, okay, and they analyze the genomic profile as to which genes have expressed more, which genes have expressed lesser, which genes are cancer supporting, which genes are cancer prohibiting. That all kind of analysis has been made in genomic profile, right? In another way, a survey of your immunostatus is also taken into consideration. For example, how expressive, how active is your immunity, isn't it? And this entire data has been taken into consideration, and then the doctors will get a proper judgment in prescribing the medicines to individuals.
Okay.
So this particular aspect is called as the personalized medicines, which here I will say that this artificial intelligence kind of things is making disruptive innovations in that, and much research is about to come in near futures.
Okay, wow. Apart from genetics, does your diet also impact on the cancer?
See, one of the basic concept, no, when the human has transformed from the Homo sapiens status, right? That means Homo erectus. When he started standing on his 2 feet, okay, he started browsing food, isn't it?
Yes.
And basically, that particular state of the art was for fulfilling the need of energy. So in short, the food that we take basically fulfills the need of energy. Okay. Now in recent times, there have been some research that the dietary ingredients have been identified as against cancer, isn't it? So therefore, people wanted to mobilize and concentrate those foodstuffs that what we call as nutraceuticals, okay, or the functional foods, medicinal foods. These all terminologies have come in recent past, where people wanted to mobilize all this kind of stuff, and they wanted to serve the cancer patients so that their health will be one thing, that they will get energy from those food. At the same time, they will get some therapeutic aspect.
Okay.
So this is how the diet and cancer are correlated. Yeah.
Do diet and lifestyle choices impact cancer risk according to your current research?
Absolutely. Absolutely. See, I just want to give an example of Ayurveda. This Ayurveda is not a, is a therapeutic regime which is meant for prescribing medicines. This Ayurveda tells you that in what way you should have your lifestyles, starting from the morning, at what time you should wake up, and what lifestyle patterns you should have throughout day, isn't it? If you follow those principles of Ayurveda, I think you can better way manage your health, isn't it? But you know that in this particular world now, nobody has time, isn't it? Everybody has his own work, and everybody in rushing towards this economic gains and so on and so forth. Nothing wrong in that, but at the same time, what is being missed to maintain the proper natural lifestyle of those people, right? And as a result of that, those particular lifestyle aggravations are leading to accumulation of stress, and that is one of the reason that stress accumulation may also initiate the initiation of cancer. So one should have a very proper balanced lifestyles, and what Ayurveda says that what diets you should take, isn't it? It's our Indian system, isn't it?
Yes.
We need to revisit that Indian Ayurveda and mainstream our mainstream our lifestyle and dietary patterns. That is my personal opinion about this.
Okay.
Yeah.
What role does nutrition play in cancer survivorship and improving quality of life after the treatment?
Yeah, I told you that. See, what is the main problem with cancer patient is that once the person has been identified, diagnosed with cancer, he or she experiences a lot of stress, and that particular stress culminates into loss of appetite. There is no proper diet, isn't it? This is one thing. When we give the treatment, chemotherapy or any therapy, there are a lot of side effects, isn't it?
Okay.
And as a result of that, the entire digestive system, there are a lot of side effects of the drug like vomiting, nausea, hair loss, and so on and so forth. These drugs are very, I will say, toxic drugs, isn't it? No cancer drug is non-toxic, isn't it? Almost all anti-cancer drugs are toxic in nature, and as I told you, they are indiscriminately providing toxicity to the normal cells also, isn't it? So the major issue with diet of this particular cancer patient is that we should have a healthy diet to these
Okay.
patients. First need, they should have fulfilled the energy requirement, isn't it? So there are multiple dietary patterns people have identified. For example, there is a Mediterranean pattern, keto diet, alkaline diet, and so on and so forth. But basically, I will tell you that the first requirement for the cancer patient is to have food intake which will what we can say, fulfill the needs of energy,
Okay.
isn't it? So this is how, if you wanted to have the there are multiple, now recently there is a lot of accumulation of literature. People are saying that during the cancer treatment, there are some dietary patterns. For example, the keto diet. What is this keto diet? Keto diet is low in proteins and carbohydrates and more in fats. So in this diet, I'm just telling you one example. In this diet, the body is compelled to utilize fats rather than the sugar and proteins. So if the body is being compelled to use the fats, then the cancer cells will deprive from the glucose.
Okay.
The philosophy behind this keto diet is that depriving the cancer cells from the growth by providing keto diet. And such similar analogies are associated with the other dietary patterns. But in short, I will tell you that no dietary pattern has till date got the FDA approval. For a simple reason, there are no demonstrated clinical effects of these dietary patterns.
Okay.
But nevertheless, there are many companies which they provide supplements of these dietary supplements. One cautious address I would like to give to the people through your channel, that as long as as good as possible, they should avoid the dietary supplements, isn't it? Because there are multiple clinical trials. People have observed that the unwanted use of dietary supplements, for example, these antioxidants, has resulted into making cancer more aggressive.
Oh.
And at the same time, the recurrence rate has also increased.
Okay.
For example, there is one clinical trial, very large clinical trial. They have provided this beta carotene, which is present in the carrot, right? And they have given to these smokers. And you'll surprise that they have developed the lung cancer. So there are multiple such studies. So unless otherwise a physician advise you that there are few supplements which are deficient in your body, I honestly feel that no one should go for these dietary supplements, isn't it? So this is how this entire dietary regimes and cancers are associated. The people should be much careful about what to take and what not to take. They should not become victim of these popular advertisements of the food companies that they do, and their motto is something different, not to give a proper guidance to the cancer patients.
Okay.
Yeah.
Drug resistance is a challenge that cancer treatment is facing. What strategies are being taken place to address this issue?
Yeah. See, Like, nature has given assurance of survival to every creature, including cancer cells,
Okay.
isn't it? As a result of that, no, these cancer cells in due course of time have learned how to get rescue from these drugs, right? And that's the reason there are multiple mechanisms. For example, one common mechanisms that cancer cells adopt for demonstrating the drug resistance is that when the drugs enters into the cancer cells, they have developed the channels on their cell walls. This called as the drug efflux transporters.
Okay.
And the moment drugs goes inside, they would efflux out. That means the cancer cells will not experience the episode of drugs, isn't it? Moreover, there are several other mechanisms where the cancer cells have smartly learned in what way these drug toxic elements should be kept aside, isn't it? And that's the biggest challenge, isn't it? Moreover, nevertheless, see, if you take a tumor, you see, and a person, if he is taking chemotherapy, only 18 to 19% of the drugs reaches to the tumor.
Okay.
Rest all is being dissipated through the journey, isn't it? Moreover, the central core of the tumor do not get sufficient drug exposure. And these cells, what we call as cancer stem cells, because they basically are within the tumor center, they become stem cells. And when your drug episode is over, and when you experience drug holidays, after that drug holidays, these stem cells again recur, and the cancer recurs, isn't it? So that's how this particular phenomena occurs. And one of the important aspect that failure of the treatment is drug resistance. Now, people, the scientific community is much alert and in little bit of pressure as to how to combat this evolving drug resistance. So they are developing the drugs against those mechanisms. For example, I told you that the drug transporters. So people are developing the inhibitors of drug transporters.
Okay.
That means these drug molecules will go and sandwich into this transporter, and the cancer cells will have no any other meaning of expelling it out.
Yes.
Right? Like that, these what we called as the drugs which will ameliorate the evolving resistance, isn't it? Another important thing is that there are some natural products people are looking for, and the natural products are basically known for management of this drug resistance. So multiple natural products, especially the flavonoids and some other plant derived molecules, people are mixing with the conventional therapy. So the purpose behind this is that these natural products will serve in two way. One thing, they will be complementary to the drugs as they have anti-cancer properties, and second aspect, they will take care of evolving drug resistance.
Okay.
So these are two aspects, isn't it? One, developing the anti-drug resistance small molecules, and second is developing the combinatorial regimes which will take care of drug resistance. Yeah.
Okay.
Yeah.
Amazing. With the advent of targeted therapies, how do you see the future of cancer treatment evolving in the next few decades?
Yeah. One important aspect, I will tell you that what is not being performed by our people is referring the cancer patients early.
Okay.
Isn't it? In our country, for example, you will surprise that the breast cancers and cervical cancers are referred to oncologists almost at third stage. By that time, the cancer has spread to multiple organs of the body. So my sincere advice will be that our people should be more health conscious.
Okay.
And they should have a clear vigilance on their body as to what is happening. Any normal person can become a victim to cancer, isn't it? So they should have routine checkup of the bodies, especially in case of women, especially in the villages. In India, we have 6 lakh plus villages.
Yes.
And the women's in India, owing to their lack of educations, are more becoming victims to this breast and cervical cancers, isn't it? Now, this targeted therapy is one of the, ray of hope for the cure of cancer. I will tell you in what way, isn't it? The targeted therapy means, which includes this immunotherapy. I told you that people are developing CAR T cells chimera antigen receptor T cells, isn't it?
Yes.
So it just, I told you that taking T cells, engineering them and doing that, okay? People are developing the cancer vaccines, isn't it?
Okay.
People are also doing extensive research on developing monoclonal antibodies against cancer cells, isn't it? Interestingly, there is one more, one more regime coming up that people are developing, training some viruses, engineering some viruses, what we called as oncolytic viruses. And the injections of these oncolytic viruses in future have chances of curing the, cancer patients, isn't it? So these all, therapies, I told you that targeted therapies, which includes this CAR T, immunotherapy, then our against this evolving drug resistance, then cancer vaccines, monoclonal antibodies, oncolytic viruses. I think these particular therapies at present, these are in, some are in preclinical studies, some are in clinical studies. So we don't have right now these therapies to prescribe for a common man.
Okay.
For a simple reason that these therapies are very costly. That is one of the challenge, to reduce the price of these targeted therapies, isn't it? And as I told you that the basic prerequisite, the burden of this cost will decrease if you have to take some 10 episodes of doses. But if you refer early your case of diagnosis, you may have to just refer 3 or 4 episodes of drugs.
Yes.
By that way, you will reduce the price of the drugs. Okay. So these are some of the things where people should be very alert and aware that they should be, very cautious about their health, isn't it? Especially those people who have some, history in their families. For example, some history for this cervical cancer, because this HPV is inherited, isn't it?
Okay.
The mother, if is having cervical cancer, the chances of getting that cervical cancer to her daughter will increase by 5%. It does not mean that it will come to that, but such families needs to be very cautious about that, isn't it? So that's how this particular aspect goes.
Okay.
Yeah.
That's all the questions I had for you today. Thank you so much for your time. Do you have any final thoughts or key takeaways you would like to add?
I think I will only tell you that, cancer studies previously were only restricted to cancer disease, isn't it? But now cancer tumor has been identified as one of the organ of the body,
Okay.
as it is giving lot of repercussions to the human physiology, isn't it? And through cancer studies, the other aspects which were not known to the people, this cancer biology research has opened another avenues even for the other diseases. So this research, I think, should continue, and our boys should have take opportunity to take these advanced techniques, advanced technologies. Especially, I will tell you that in coming days, the intervention of AI in clinics in terms of diagnostics and other, even in prescription of drug, people have already started using artificial intelligence for prescription of the drug, isn't it? So majority of the decisions will be taken by the human itself, the people itself at home, using the interventions of AI. But the basic prerequisites and the basic requirement is that our people should be learned enough. They should be educated enough, isn't it? So taking education is the basic fundamental aspect of minimizing the cancer burden. Thank you so much.
Thank you so much, Doctor. And I look forward to more advancements in your field.
Thanks for your time. Thank you.
Thank you to our audience for tuning in today. Do like and subscribe and leave a comment on what else you want me to talk about. Thank you.